you know what, the way I do it, and I know that paper that I gave you has it all crazy, but I just out here the baby. I'm doing an assessment when a baby first comes out, because that's where I am. I'm not in postpartum, but of course I can do that over there too. But it's a lot more thorough when your baby first comes out, because you want to make sure everything is working right and everything's right. So baby comes out, first thing you got to do is just dry and stimulate that baby, and you want to do the head to toe. So I'm looking at your fontanelles, which they don't have it here, but you've got the one on the top and the back, the diamond and the triangle, and you want to make sure that they're just even, because if it's bulging, what can be a problem?
Intracranial pressure or something?
Too much pressure, maybe. It's something going on with the baby. If they're sunken, what can it be?
Dehydration.
Excellent. And so here's where you're going to find your ears, whether the cartilage is springy or not. If it's just flat and droopy, it's less. The gestational age is younger. If it's springy, it's closer to 40 weeks. Okay. It's not an exact science, but you put them all together on this one assessment scale that they have in there, then it helps. So we're looking at the ears, you're looking at the eyes. Sometimes you will have an eye hemorrhage, like a little red in the white, the sclera area, because of something going on when the baby was in there. Maybe they're asynclitic or, something. And so the eyes, if you're having a hard time seeing their eyes, you want to do this so that they'll open them, because they're not used to the light. If they're being noisy, you can have a gloved hand and put it in there so you can listen to their vitals better. And then at that time, you're going to check their palate, because their palate is right there. See if you feel it being covered. They have a suck reflex, so that you're checking that right then too, right? Then you're looking at the ears in relation to the eyes. If they're low set ears, that might be a Downs or other anomaly situation going on. So you'll see that on assessments. If they're the same, you're good. You're looking at the neck to make sure there's no skin folds, extra folds. That's another thing that can be a trisomy type of thing, anomalies. You're looking at the clavicles here. If you feel that tissue paper noise, you hear that tissue paper noise, it could have a broken clavicle. With crepitus, usually takes a day or so for that to start, though. If it just happened during the delivery, it won't be. So you're just going to feel for if you feel any asymmetry or break, there. They're going to have a grasp reflex with their fingers, so that might be assessed when you're trying to move things. The breast buds, little tiny 1 millimeter, 2 millimeter, might be a younger gestational age, 2 to 3, 4 millimeter with buds that may be an older baby. You're just going to feel the abdomen for rounding and make sure there's no masses there. You're going to go down and you're going to check, like we talked about earlier, that cord to see if it's a 3-vessel cord. See the 2 arteries in the 1 vein. Call it out to your other nurse. I have a 3-vessel cord. Good, because that goes on the delivery summary. They need to know that. At some point, you're going to do this procedure, this maneuver called the Ortolani. There's another one, Ortolani and Barlow, I think it is, where you do. This one's Ortolani. If you hear a hip click, then you might have one hip that's out of joint. You need to know that. This is the other one where you lift it straight up. It will click out of the socket in the hip. If you don't hear anything, you're good. Then you're going to, on the male, you're going to see if the testes have rugae and the testes are dropped, then you're older gestational age. If they're smooth, you probably, and they're not, and they're non-descended, they're up higher, then it's a younger, okay? And the female, if the labia, the outer labia are covering the inner, then you're going to be further gestational age. If they're both exposed, it's probably younger. Okay, there may be a little bit of blood discharge because of the hormones mom's putting out. They might have a little bit of discharge of blood there.
Their labia is so like, like swollen when they come out.
I think it's the hormones is what
Okay.
they say is that it's
Okay.
causing that. Okay, so then you're gonna check your back. You're going down the spine to make sure that you feel that and that it's symmetrical. You're going to be going like this with the butt cheeks here to see that there's no break in the skin in that dimpling area because of spina bifida. You want to make sure you're all covered there. Okay, and the patent anus, which you'll know if baby has a meconium before birth, then you know you've got a patent anus, right? And then if it's afterwards, maybe an hour or two later, you're gonna, right, okay, we do have poop, that's, you know, but if you're just kind of looking, you can just look, make sure that the anus looks patent. Also, when you're doing the initial assessment on the head, you're seeing if you have patent nasal, which is harder to tell, you know, they're obligate nose breathers while they're this small, so you should be able to tell looking in all the orifices. So another reflex is the Babinski, where you touch their foot like this and it flares. Or if you go down the middle, they should flex their toes. Okay, it's just like the finger. When you put your hand right there, your finger right there, they will grab it. It's just a reflex, same as here, their little toes go. So if you want to do some good footprints, you're kind of, you know, going, come on, and then they'll go like that, and then you.
Oh yeah, that's smart.
So you got some people are really good at the footprints doing that. I'm not that great, but I do all right. What other reflexes? The startle reflex, or I can't remember the name of it. Moro. And you're supposed to pick them up and then slightly like this and just let go, and they go, you know, you'll see them startle on their own just if you get near them too. That startle reflex is just to see if they're present. If they're not present, they might have issues going on that the ped will want to check into, and I don't know what the particular ones are if certain reflexes not there right now. But
When does the pediatrician come see the baby?
within 24 hours, they come like the next morning.
Okay.
So if they were born this morning at 5 a.m., though, they may come today, you know,
Oh,
to see
okay.
them on their
That's very
rounds. So within 24 hours, that way they don't have to come at a weird hour. So I've had them where you're over there at 5 o'clock in the morning. They just delivered, you know, your night shift, and here comes your ped, because she looked at the board and she wants to get that one out of the way. So she'll see them. They just were born, and they come over and do their own little assessment, you know.
So
Okay,
if-
so your baby vitals. What is your normal baby vitals?
They're tacky. Aren't they
30, 60
tachypnic too, right?
If you
Well, I mean not tachypnic,
compared to adults,
yeah.
yeah. So their normal though is